What's the first thing that comes to your mind when you hear the word cannabis? Marijuana, multa, weed, the devil's lettuce? Or maybe some sort of more negative sounding words like stoners, lazy, drug addicts, or even criminals. Today I'm going to inform you of the uses of the sativa plant and some medical benefits. I'm going to inform you on how to understand the medical capacity of cannabis, of what it can actually provide treatments for. We're going to be discussing two compounds of the cannabis plant, the history of cannabis, and some current legalities. According to the Encyclopedia of Drugs, Alcohol, and Addictive Behavior, 2009 edition, it says that cannabinoid compounds in the plant are directly responsible for the effects of cannabis, meaning that the plant itself is responsible for its effects. Delta-9 tetrahydrocannabinol, also known as THC, and we will refer to it as that through the rest of this. This compound provides the psychoactive effects that one receives when partaking in the usage of cannabis. 2015 Drugs in American Society, Encyclopedia of History, Politics, Culture, and Law tells us that when you consume cannabis, this is what determines your absorption levels. The ways that you can consume cannabis are smoking or vaping, eating or drinking items that are infused with THC, as well as you can apply it topically. The THC passes the lungs through the cannabinoid receptors on the surface level of the nerves, and then it passes the part of the brain that influences memory, concentration, as well as coordination and euphoria. The cannabinoid structure changes in each individual strain of THC. That's why different strains of the plant causes various effects. The Dominion Post of 2007, researcher John Ashton tells us that having positive effects on pain management because of the way the psychoactive triggers the CB1 receptors in the brain. So this psychoactive state can be viewed as a negative side effect. So when you compare that to other pharmaceutical medications, such as Norco, for example, you get the side effects of drowsiness. The euphoric high in THC can be viewed as a negative side effect. Ashton also stated that the Rastafarians have used cannabis for medical benefits for ages. So that means somebody has already been using this and treating medical concerns. There's three classifications of cannabis, and they are separated by these classifications due to the results of the effects of how your body responds to the cannabinoid system differently. Now, knowing the strains, it is helpful to find the best strain that is intended to treat the symptoms that you're having. The three classifications are indica, sativa, and hybrid. Indica is a sedating, more relaxing. This helps with pain as well as insomnia. The sativa is more of a euphoric, uplifting, creative strain that helps treat nausea as well as depression. The hybrid is a combination of both sativa and indica, which can give you combined results treating different things. So you can be getting that hunger, also a euphoric feeling at the same time. Each classification, indica, sativa, and hybrid, there are many strains, and each strain is given its own name. The names generally determine where the plant's origin is, what the effects are, or even the flavor of the plant. 2014 publication of the Gale Encyclopedia of Alternative Medicine tells us there was a study, an American Journal and Hospice of Palliative Medicine. This study replaced cannabis with the opiates, some or all of the patient's opiate treatment. And cannabis was proven effective in relieving these patients' pain. Now, opiates, there is a high risk of death, whereas cannabis, there is zero risk of this. The cannabis was used to treat terminally ill patients with cancer, HIV, or AIDS. It's been used to treat inflammation as well as preventing cancer cell growth. The body has receptors that naturally respond to the THC and provide a euphoric sensation. That is secondary to the treatment of the main component, whichever the patient is trying to treat. You are able to receive cannabis healing components without receiving the psychoactive component. That's the fascinating part about this plant. It has so many varieties of ways that you can treat with it, with psychoactive or non-psychoactive. It is possible to not trigger those CB1 receptors with cannabis use. Cannabis oil CBD comes from the hemp plant or the sativa plant, cannabis sativa plant, which has very small amounts. It can be used to treat a variety of symptoms. In October 23rd, 2018 publication of the Philadelphia Inquirer, CBD has one FDA and one DEA approved application, and that is to treat a rare form of epilepsy in pediatrics. There is no prescription for CBD, so there is no FDA oversight, which does cause some concerns because if there's no oversight, then there is no required testing. So that just shows the need for additional research with CBD. CBD can use to treat PTSD for military vets. A November 2019 publication, Associated Press, State of Iowa, expressed that even though the use of cannabis is not their primary form of treatment, it has proven to be effective. CBD can heal without psychoactive results. It is important to know the progression of the laws of cannabis where you reside. U.S. history has been on and off with cannabis. The movement has been slow, but it definitely has been having movement. We went from the gateway drug to now cannabis is deemed as essential. In 2013, St. James Encyclopedia of Popular Culture says Western doctors in 1835 discovered cannabis and began to study the results of cannabis and human consumption. Cannabis relieved pain in terminal patients, and as medicine began to advance and other pain management methods were developed and easier obtained, the use of cannabis subsided. Each state has different laws related to cannabis. Currently, cannabis is federally a Schedule I drug, which is the same classification as heroin and ecstasy. Schedule I drugs, federal level, are currently illegal. California medical access to those young as 18 is available with a medical doctor's recommendation and recreational usage for 21 and older. California cannabis vendors are regulated by the California Bureau of Cannabis Control, the BCC. Through legalization, cannabis vendors are not to be looked at or treated like criminals anymore, per September 24, 2018 article in Bazinga. All products in the licensed regulated market, cannabis market in the state of California, products are lab tested in batches. The packages is child-proof, and the testing results are posted in plain, clear sight. They're advising the THC levels, the CBD levels, as well as any chemicals and pesticides. Cannabis has strict packaging regulations, even more so than alcohol. Schedule I drugs are federally illegal. However, they do not currently seek criminal action towards consumers. It is important to know the laws of cannabis based on where you are at. Today we discuss the two most common cannabinoid effects, medical usage, and the legalities associated with cannabis. With using cannabis, you decide how you medicate and how you treat. Some think of cannabis users as addicts, stoners, or lazy. Hopefully after today you will understand that these people are also patients.